Hello, how are you? My name is Paul. I'll be your student nurse today. Clean my hands. Can you give me your name and date of birth, please? Blah, blah, blah. Thank you. And let me check your order here today. Okay, looks like we're going to be inserting a Foley catheter. Have you ever had that done before? Good. Well, we're going to make sure that it's painless and as smooth as possible. Let me put on some gloves here. So I would put on gloves at this point. And so let me get you set up. Let me get that up so I don't break my back. Needs to go quite a ways here. Alright, so I'm going to move the top blanket up and just leave it on your torso. And I'm going to pull this bottom blanket down, so I'm going to go ahead and expose you at this point. And at this point I would check the periurethral area to see if it's visibly soiled and if it needed to be cleaned. We're going to assume it's not. And so what I'll have you do is pull your knees up to the side. And it looks like this is as far as this mannequin is going to want to go. And so we'll just roll with it. Okay. So I'm going to open my catheter kit now. Put this pad underneath your bum. Just lift up your hips a little bit for me. Thank you. And now I'll go ahead and put on my sterile gloves. I'm going to do hand hygiene first. And I'm going to make sure they're nice and dry this time because I broke my sterile gloves last time. So. And so I would go ahead and shoot this lubrication into this bin here, set that off to the side. And I'm going to go ahead and attach this sterile water to the side of the Foley there, twist to make sure it's tight, and then we're going to be all set to move this over by the patient. And so I would use these iodine swab sticks. I would go ahead and open that up, and I would, at this point, I would be all set to use my non-dominant hand to open up the labia, and I would hold it there. Use one wipe down the right side, one wipe down the left side, and one wipe down the middle. Obviously that wasn't ideal just there, but just to get a little bit of lubrication. I would spray this with lubrication, and I'm going to go ahead and insert this now. And I think I will need a little bit of that lubrication. If my assistant doesn't mind giving me a little spray here.
Sure will.
Okay, thank you. And I'm going to go until I see a little bit of urine leak to this box here. And so at that point, I would go ahead and fill the Foley with 10 milliliters of water. And remove that. And then I would go ahead and check just to make sure it's in. And we are in. I'd remove all of these supplies. And I would attach this down here. Let's see. Okay. Let me take off these gloves. Hand hygiene. And we'll get the patient set back up. Oh, and there's one thing I forgot to do, which is to attach the Foley to the leg here, which I would do with sterile gloves. So we pull that back down. And the last thing I would do before removing is document. We'll be all set. Hand hygiene one more time, and I'll be on my way. Knock, knock. All right, sir. Ma'am, you ready to take your Foley catheter out? So let me don some gloves. At this point, I would put on gloves. And so I'm going to lift this up and pull this down. And I would have a towel underneath here, as well as gloves on my hands. Use this syringe to remove the 10 milliliters of water. And just remove that, just check to be sure that all 10 milliliters came out. And we're good. And so I'll have you bear down, and we're going to pull, and we are good. And I would remove this. I'd be able to empty this into a bag if the doctors wanted a sample, as well as record the amount if we needed it. And I would throw this away. Take out this towel. Throw that away. And we can let the patient back to their routine. And we'll lower the bed back to its complete lowered position. And do hand hygiene, and we would be all set.